Shadow Minister for Finance, a manager of opposition business in the Senate, and former Chief Minister of the ACT, Katy Gallagher. Thanks very much for your time.
Thanks.
First of all, on the ACT and the Canberra lockdown, did it seem inevitable that we would end up here? It's been well over a year now since there was one case, now into lockdown.
Yeah, I think anyone watching the escape to the regions of the Sydney outbreak has been wondering when it would get to the ACT. I mean, we were hoping it wouldn't, but obviously this positive case has arisen and swift and quick action needs to happen to make sure that we can keep people protected and keep the case numbers low or back to zero where they've been for the past 12 months.
You know the health system better than most in terms of the ACT. Does it have a good tracing capacity? Are they up to it in terms of the testing and so on, and can they nip it in the bud?
I would, absolutely. Look, I think they're a great health outfit here. I think the other thing is we've got we service a region, so we're sort of equipped to deal with quite a large population here. We've also had the benefit of 12 months of watching what's gone wrong and what's gone well in other jurisdictions, and I think that the ACT government and ACT Health will have learned all about that, which is why you've seen the lockdown. I think, one case and a 7-day lockdown, that's been learnt through, I guess, some of the failures of the quick responses we've seen in other jurisdictions where it has, cases have got so much higher before lockdowns have happened, and that's, in Sydney's case, been really devastating. It's
a jurisdiction where the vaccine rates are also higher than the national average, much higher in fact, and it's a test of that, isn't it, as well as one of the defences against this thing?
Yeah, absolutely. I mean, we've been rolling the vaccine out really quickly here, and I think, we've got a very engaged population who wants to get vaccinated. There's been issues about supply here, like there has been everywhere else, but I think we've now about a quarter of the population fully vaccinated. And more importantly, I think those over the age of 70, the levels of them being vaccinated is much higher. So, yes, I mean, that's part of the solution. Obviously, they need to get a lot higher than that before we protect the community. So this 7 days, it's really important that we all do what we can to help stop an outbreak happening here, to really stop it in these early days.
You are also the chair of the Senate, the Select Committee on COVID-19. The government says it's done everything it can all along in terms of acquiring the vaccine, and now we are thankfully seeing that rate tick up, more than 500,000 people vaccinated, or at least have one dose over the last 48 hours. That's great news, but it has taken a long time. What's your view as to the fundamental reason why more doses weren't acquired sooner?
Well, we were going to have some hearings into this next week, which we've now had to postpone, to go through this in sort of more of a forensic detail. But from the evidence we've had to date, I think the mistake that was made back last year between July and August, when decisions were taken to really buy AstraZeneca deal and a very small amount of Pfizer, they did have the University of Queensland deal on the side as well, but that fell over, and I think that was the mistake. They didn't have enough deals, and in those deals they didn't buy enough, and that left us, when there was a problem with AstraZeneca, when the eligibility was restricted based on health advice, that left us vulnerable to not enough supply and some of the issues around hesitancy. So I think the mistakes were made last year and we're paying for them this year, and that's coupled with quarantine failures, has led to millions of Australians being in lockdown for weeks.
In terms of the supply though, we've had millions of doses of AstraZeneca. Have we been the victim, first of all, in terms of complacency, but secondly, not communicating some of these very complex messages? I'm not saying it's not, obviously, in terms of health advice, but unfortunately it's had this flow-on effect of worsening the hesitancy problem.
Yeah, I think in time, in the future, we'll go back and have a look at what happened with the communications around the vaccines, and it's been terrible. There hasn't been a public health information campaign of any serious quality, partly because of the supply problems. We had General Fruin saying he didn't want to put out an ad campaign because they didn't have the supply to match that if it did make people more willing to have the vaccination. So there hasn't been public information. And then we've had series of, late night press conferences with, sort of urgent information being given. And the message the public got from that, and I've had plenty of people say to me, when you tune in late at night and see the Prime Minister and the Chief Health Officer saying you shouldn't have this vaccine based on health advice, you listen to it. I mean, that advice has now changed, but at the time that created some concerns around hesitancy, quite obviously, and reasonable ones.
Do you think there should be a mandated requirement for vaccines in certain industries and to, say, visit hospitality venues, restaurants and so on?
I think that discussion needs to be had. I think it is a tough one because I think all of our vaccinations really are the strength of our vaccination program for all of our vaccinations. Childhood immunisations, the rest of them have been, about voluntary engagement, getting people to do it because it's the right thing to do, not because they have to do it. So I think it's definitely a conversation we have to have. We have to work through the pros and cons. But I also think it's been a bit of a red herring, which is let's have a discussion about mandating when there hasn't actually been the supply to get the levels in the community of the people that are willing to get it. And I think that's been, a tactical decision, but I think it's sort of made us have this conversation over here when the real one is how do we vaccinate the people as fast as we can of the people that want to get vaccinated.
Are you encouraged by that number that I said before, up over 14 million doses, more than 500,000 in 48 hours? That is starting to get that momentum.
Yep, absolutely. Vaccination is the way through the pandemic. There's no doubt about it. Look at all the evidence about the impact of a fully vaccinated person in terms of actually contracting it, the symptoms they get, the hospitalisation rates are so low, and of course, dying from it. 94% protection for once you're vaccinated from dying from COVID-19. It's a pretty good outcome. So, yeah, we need more people to get vaccinated as fast as we can.
And finally, given the outbreak in Canberra, should Parliament return in a bit over a week?
Well, I think we've been really responsible in Parliament. I mean, we've been all wearing masks. The public health measures we've got in place now are much stronger than the rules that existed in the ACT, so we're very conscious of it. I think we have to wait and see what happens. There'll be discussions, no doubt, people pay grade higher than mine about what happens, but absolutely we're advocating to make it safe here, but also safe for the ACT community as well.
Shadow Finance Minister Katy Gallagher, appreciate it. Thanks.
Thanks very much,